Welcome to the Extraordinary Health Podcast. I'm Dr. Paul Beckham, your host, and I have with me today Liz and Allie again.
Hello again.
Hello.
I think they're going to break out in song here soon. So,
Was very harmonious.
yeah.
Is that a word? Okay.
Wow, she's getting chatty here today. Today we're going to actually talk about neuropathy. What is the big question is, what is neuropathy? What is neuropathy?
Oh, well, neuropathy would be loss of sensation, strength, feeling in an area of the body.
Yep.
Do you want me to elaborate more? I was just trying to keep it simple, I guess.
Yes, there's several different types of neuropathy that can happen. I mean, there's a motor neuropathy where people are going to have dysfunction where they're not going to have the proper strength. We can do some manual muscle testing. I mean, you can do computerized muscle testing as well, but we just want to find out if a person, they might think of it as weakness, but usually it's because the muscles are inhibited because something is causing a problem there along the signal kind of going from your brain out to that peripheral tissue. Usually it's happening either in a muscle, tendon, ligament, joint capsule, joint synovium, or it could be from like an acute injury. You have pain fibers in your skin or in the periosteum of your bone, so your body's just going to shut it down. It's just not going to work well, so you're going to get a neuropathy from that. People could have a sensory neuropathy, where usually that probably comes from like a diabetic type neuropathy, where you're getting, the arterioles, the kind of the smallest blood vessels, are either getting a little bit harder, or the blood cells themselves are sticking together, so you're just not getting that proper circulation out, and that usually ends up showing up in the hands or the feet. People can also get an autonomic neuropathy, and we have some testing equipment coming in here to help us even determine, a lot of these things here. So the autonomic neuropathy could be coming from, your heart. It could be coming from, again, not getting that proper signal because now you've lost that blood circulation going to the extremities, like the tips of your fingers or your toes, and the nerves are dying. So you'll get a sensory neuropathy where you just can't feel it. And we can test that with like monofilaments. We can test it with vibration as well, to just find out exactly how much of an area, this person does have effective, so that when we get down to getting them treated, we make sure that we're getting those areas, especially treated well, so that way they're getting that sensation back. So what have you guys seen here now? Like, when we get patients in that do have neuropathy going on, we have several different treatments here that we generally combine together so that people get the best results as fast as possible here. And one of them is using our class 4 laser that helps to even regrow those nerves. It helps to improve that blood flow. It can make the arterioles a little bit more flexible. It's going to help increase ATP production, so of all that energy that those blood cells are actually even circulating out to those peripheral tissues like your fingers and your toes and all that sort of stuff, is going to literally help just improve the energy that's going to those cells. So that gets into just improving your body's energy overall, as well as healing things, because typically it speeds it up by about 30 times, so that you're just not having that time in between sessions. So if we literally get it treated, we can treat it every day if need be, and that might be the case in somebody with a really severe condition. But kind of also rolling back here now, it definitely helps reduce pain as well as inflammation that a person has going on in those areas as well, which that might be a portion of what is causing some of that sensory neuropathy there. So what have you guys kind of seen here when you've been treating people here, with the laser, as far as how they respond with it?
So what would be interesting actually is if we had patients that we just treated with the laser for a little bit and then added the other therapies as well. But I know that in conjunction with a couple of our other therapies, for sure, that the laser has been quite the what's the word I'm looking for? Basically, patients getting the laser have shown quite a bit of improvement.
It's probably the primary therapy.
Yeah.
Yeah. I mean, I've seen patients that have had, like just purple toes. They just have really decreased circulation, even to the point where they're even getting a little bit on the white side. I mean, that's getting out there where they're really even starting to lose some of that blood flow. And, after you apply the laser, all of a sudden they're looking, normal and pink. And, they generally can, it depends on how severe their neuropathy is. They can usually even start to feel things a little bit better, even right after, one treatment too.
It's the best first step, I believe, because of all the benefits. You're bringing, the laser does get a little bit warm, not hot, a little bit warm. It's bringing all that blood flow to the area, increasing cellular metabolism. So it's like the best first step as far as therapy, treating that neuropathy, because it can be instant as well, just like Dr. Beckham said. So pretty neat stuff.
Yeah, it's amazing just to see the change. I mean, I know I've taken some pictures of patients' feet, pre-treatment and post-treatment, right away. And you can just see that increased color coming back, that increased circulation coming back. So usually also with the laser, the laser is probably the best treatment here. I mean, a person, if they do have neuropathy going on, they should really be looking at, doing some of this treatment first, because you really want to wait to use any kind of drugs or, surgery's last resort, but there's really not a good surgery to deal with neuropathy. The only thing a surgery would be used for is if you let it go way too long and you end up getting some kind of gangrene going on, and then they're going to be amputating. So you don't want to get to that point where you have to have a surgery, because that's where it's probably going to head towards. So you're going to be losing some toes or a foot or a leg, and that's not what a person probably wants to be doing there. So but another therapy that we kind of combine with that then is a therapy called PEMF therapy, or pulsed electromagnetic field therapy. And that in and of itself too it's an electric stim kind of therapy. A person is definitely going to feel this, but it actually helps just get your body's, again, circulation going really well here. Typically, we're going to use like either a zero gravity mat where you lay on it, or you're going to sit in like a rocking chair, basically, that's going to cover a bunch of area there. And then, if it's your feet that's involved, we'll probably get those covered or kind of sandwiched in between some pads, so that we can really help stimulate those areas to get the blood flow going back into them, get that nerves kind of regrowing as well. So using that in combination with the laser therapy is super helpful. I know you gals have probably seen a few patients with the PEMF therapy, some with neuropathy, some without, but, I don't know if I've seen anybody that's, had PEMF therapy that really doesn't enjoy it and find it to be super helpful in just about every condition that we put on there. So
I feel like if they do it one time, every other appointment they come back, they always want to do it again.
Yeah.
Yeah, I think that's just a testament, for sure, to how helpful it is for so many different things. The nice thing about what we have here in the office as far as PEMF therapy is we have, like Dr. Beckham mentioned, we have a zero gravity bed. We also have a chair that you can sit in, but we have other accessories such as paddles and rings that we can apply directly to areas that have any kind of neuropathy. We can put them around the feet. We can put them around the lower legs or the hands. So we have all the accessories that you need for the right fit for whatever neuropathy that you might be dealing with.
Mm-hmm. And it's also good for plenty of other things too, like arthritis and all that as well. But we're just trying to focus on neuropathy right now, just to give people a better idea. So, and another therapy that we'll kind of include with it as well is going to be some vibration therapy, and that helps to really just stimulate the nerves, because that helps you get that connection going back and forth between your body and your brain. And it's a therapy that doesn't take much on your part. We have one that's just literally one that's going to help just stimulate your feet. You're going to get that vibration there, but then we also have some vibration plates where we can even have people doing some exercises and stuff like that on even one where it's like a chair, so you can be sitting on the chair doing some exercise, get some mobility going into your hips and pelvis and spine and all that. So depending on what a person needs and what they can do, we have lots of options here to make sure that we get you better as fast as possible here. So kind of besides some of that, I mean, if you have neuropathy going on, I mean, some of them that actually even respond the quickest are more like a person who's gone through chemotherapy, because if we get them going, get them treated, usually once we get that cleared up, they're going to be golden. It really shouldn't come back, because we just need to get their body kind of detox, get that stuff cleared out of their system, and unless they go through chemotherapy again, they really shouldn't have that neuropathy return. I think just thinking of that, going back to, my mother went through breast cancer treatment, and reading through some of the materials there, I think she was one of the first ones that did get tamoxifen. I read through it and just looked at it, and it's like, you can't have folate, you can't take B9, but it looked like it was B6 and B12 that were the problems there, and I had her just go to her oncologist, and he, gave the okay for her to take that, and she was able to get through her chemotherapy treatments and not have any neuropathy. And there's a high percentage of people that will get it. I mean, I can't remember the exact number, but I want to say it's in that 80% range, right around there. So don't quote me on that one, but it was quite high. I know when it first came out that people would end up with a neuropathy, whether it be in their feet or their hands. So chemotherapy can be another form of neuropathy that can go on. There's people that are exposed to chemicals, whether that be industrial chemicals or farm chemicals, agricultural ones. Again, if you kind of get away from it, get yourself detox, get that stuff cleared out of your system, by going through the treatments here, we should really get it cleared up, and you really shouldn't have it come back. But, if you're just going to go back and get exposed again, you're not going to have probably as greater results. But I think the vast majority of the patients that do come in the office, I mean, we're looking at over 90% have excellent results, with the laser and all that. In fact, I really, in myself, I can't even recall anybody here who has followed through with the treatment that hasn't gotten great results. So,
and something I was reading the other day was talking about, if you aren't seeing the results you're looking for with just doing laser therapy, it also could be based off of like vitamin deficiencies.
Yep.
So it's something that if they're not seeing what they want, that's something that we could do here as well, is looking into that.
Yeah, Dr. Beckham actually touched on that with that B12. So a B12 deficiency can cause neuropathy. So just kind of balancing all that stuff out, like Liz said. If one thing isn't working, we're gonna work with you and try and figure out what does work, because we can throw the kitchen sink at it. Everything in the everything but the kitchen sink.
And that's where we can literally get into it. I mean, it's a simple process here to get into some of the functional medicine stuff. I mean, there's a questionnaire that we can look at that will get us started, and to see maybe where you might have some areas that we need to look at a little bit closer. If needed, we can even order some labs then to even find out exactly, where your labs are at there, and if that's even indicating anything here. So there we'll have some more objective tests to kind of determine exactly, what you have going on, because we want to make sure you get the best results here. I mean, that's the bottom line with all of this here, and why we have all the different therapies here is to try and get you the best combination to get you the results that you're looking for here. I mean, if you start to have neuropathy and you're not doing anything with it, or you're just using some medications, I mean, the problem with some of the medications is that of all the patients that I've seen, I mean, it could be a year or two, and then their body finally gets kind of sensitized to the medications, and they just don't work anymore. So getting a consultation here to find out, if you have some neuropathy going on. Like I said, we got testing equipment coming in the office here so that we can literally get you tested, find out if you have problems going on that way, you have circulatory problems. This testing equipment is recommended by the American Heart Association, the American Diabetes Association. It's going to give us a really comprehensive look at your internal organs basically here, and see how they're functioning, and see if they're affecting the neuropathy. And if there's other things that we're finding that, maybe need to get referred out, we can, definitely get you referred out then, because we'll have that objective testing to really show you, where you need to go, and we'll make sure you get the appropriate treatment as well. So, but yeah, there's just getting started on it here, we want to try and look at everything as much as possible. We're looking at, there's even structural things. I mean, we can have people coming in and actually some of their problem is coming from a disc problem in their back. So we always want to rule that out as well, because that would be a completely different therapy that we'd want to be using in the office here to get you the best results there. Some of the more stubborn ones we're going to even want to use, it's called orthotripsy, or another name for it is shockwave therapy. That can help stimulate some stem cells in your own body here. So we're not injecting anything. We're just using this therapy, and it's been shown to help stimulate your body's own stem cells so your body can heal itself. So, we can get that run on your hands or your feet or any other area that, might be, causing some of that numbness and tingling in your hands and feet. So the nice part about that therapy is we can use it to even diagnose you, find out where the problem's at, and if it's like we hit something and it feels like it's making that numbness even worse, or you feel it a little more intense there, that's there. We probably need to get treated for you. So utilizing that to help clear things up can be very beneficial then as well. So we might want to make sure we include that in your treatment plan then to help resolve your neuropathy. So I think besides that, I think we've covered most of the things that we have in the office here. Obviously, people have different questions and all that sort of stuff. Again, you can always contact us here, and we can get those questions answered for you. No question is a dumb question, because there's probably somebody else out there that has the same question that you're thinking about. So just throw everything at us here, and we'll get you the answers that you're looking for here. If you think you might have neuropathy going on, please, contact the office. You can have a complimentary consultation here, and we can, just see if it is something like that going on. If it is, then we'll let you know what we need to do to kind of get you screened further here to make sure that we get you the most appropriate treatment. So
Yeah, if you're thinking, well, gosh, my fingers just go numb a little bit here and there. It's not that big of a deal. I say don't wait. Some things that we didn't really touch on, other than the gangrene issue, is it can cause other issues. If you have like an autonomic neuropathy, it can affect your blood pressure, your heart rate. It can even affect your bowel and bladder eventually. So, something that you definitely don't want to just push to the back burner. It's something you want to kind of touch on right away, because the sooner we catch it, the sooner we can get it treated, and you'll be better off for it.
Yep. With anything, get it assessed as early as possible, because the earlier you get in, usually the better the results that you're going to get here from the treatment. So, okay, well, I think that kind of wraps it up here for today. I hope you enjoyed what we had to talk about. Again, any questions that you might have, please feel free to contact us. If you want a consultation, contact the office. You can get a complimentary consultation to see if this is something that we can help you with. Other than that, have a great day, and we'll be talking to you next week.
Thanks for listening.
Bye.
Bye.